Hello, everybody. This is our first fireside chat of the spring semester, spring 2021. We are joined by Dani Stanbouly, and we're going to be talking about being a dental student at Columbia Dental Medicine. So thank you so much for being with us. And if you wouldn't mind just giving yourself a quick introduction.
Yes, hi, how are you? How's everyone? So yeah, I'm currently a D2 at a D2, a second year. That's what we call it at Columbia. And yeah, I went. So I was born and raised in Dubai, like the UAE, and graduated high school there, and then came to the U.S. for college. And I went to college at Michigan State University in Michigan. I don't know why I'd say that, but but then after that, yeah, like applied to dental school, like and gone into Columbia. It was my first choice, thank God. Like I remember, I got into Michigan, like University of Michigan initially, like, but and I was and I was set to go there, but then I remember like I was on the wait list for Columbia, like, and and I really wanted to get in, and I thought like it was May, and I like still didn't hear back. So I was like, at this point, I was like, forget it, like it seems like I'm just not in. But thank God, like mid-May, like I got the acceptance, and so now I'm here, yeah, at Columbia, like, and yeah, it's a great school, like. No one's paying me to say that, I swear, like. So yeah, that's an intro, like.
It's awesome. So we usually like to start these with kind of a baseline. What made you want to be a dentist? What made you want to go to dental school? And so if you wouldn't mind just telling us a little bit about that.
Yeah. So if I think back, like, I remember when I came and I went to college, like my first year in college, like I wanted to, like, I definitely wanted to do, I was a pre-professional, I definitely wanted to go to professional school. Like, I mean, for me, honestly, growing up, I have to give it to my parents, like my mom, like, I don't know, this is just a funny story, but like, one of my cousins, like, so he's way older than me, but he was a dentist, like, when I was born. So, and his name's Danny, like, so my grandfather named me Danny, like, saying that this kid's he's gonna be a dentist, like. So growing up, like, it was like a prophecy. I know this isn't the real reason, but it's one of them, like, where they're like, my parents just were cheerleader parents, but not in a bad way. Like they like, they supported me, and kept reassuring me that, you should go into pre-professional school, be a doctor or a dentist, because they saw my love for sciences, not because of like, they wouldn't just do it for that. Like I loved sciences early on, like in high school. I loved chemistry. I loved biology, was something I just loved reading, loved learning about, even, in my free time. So going in college, I wanted to go into medicine or dentistry, like, and then as I, went to my sophomore year, it was time to really decide like what I wanted to do. And I I was shadowing doctors and dentists, and I really liked like the degree of handwork that's involved in dentistry. Like, that's not to say that I didn't like that, like in medicine, like where you'd, if you'd become like a surgeon or something. But the thing is, like, it's not a guarantee. It's not intrinsic to the field, like as it is in dentistry, where you finish dental school, you're gonna go into general practice, like, it's all dentistry. Hand skills is inherent in dentistry, basically. So I love that. Like, I loved the degree of handwork, the art in it. I personally draw, like, and I love to draw a lot. So with that, I was like, I that cemented, yeah, my sophomore year, my decision, yeah, to to go into to dental school, like.
Awesome. And just a reminder for everybody, if you do have any questions, feel free to jump in, in between when I'm asking questions or following things up. But so you had this kind of drive to do a profession,
Yeah,
fell in love with dentistry from your love of science.
yeah.
What was that transition like going from, an undergraduate to dental school?
Like first year, didn't really do anything, didn't really like investigate. Like, I was still not sure, and I didn't put the effort to like you know really like look into and shadow each field, observe each field. But in what's it called? In my sophomore years, when I began shadowing, like, doctors, primary care, physicians was the main one. It's unfortunate because you can't really shadow like, it's harder to shadow like specialists. So you couldn't really like, I couldn't really like gauge whether I wanted to do it. That's not to say that I regret going into dental school or something, but then I shadowed like dentists, and that was really like the more I shadowed, the more I learned about dentistry as much as I could, of course, as a college student, because there's a lot you don't know now. Like even though you guys shadow, you shadow and you observe. There's a lot of terminology. There's a lot of stuff, but by shadowing a lot, that's what really made me. Um, that's what really helped my transition, to becoming more of like a pre-dental student in anticipation, for dental school. Like, yeah.
And when you got to dental school, was it like a big change? Was it very different?
Yes,
Were
yeah,
you kind of
yeah,
used to the,
exactly.
where, okay.
Yeah, now the thing is, it is a huge transition. Why? Like, the workload's just so much more, like, you're taking so many more credits. Like, the pace at which you learn is so much faster, like, and they do that on purpose, like, to what's called to train you to go through material faster, so at first it's overwhelming because, like, in undergrad, like, you um don't really take that many credits, like 14 to 16 credits, whereas in dental school you go up to like 27, like, credits. So they teach you to be able to really go and study material quickly and really be as fast of a learner as possible. It's a conditioning process, and the thing is, you get overwhelmed in the beginning, but that's okay, because that's you getting used to it. You're getting conditioned. That's, if you're not struggling, then you're not, you're not changing. So yeah, that's, one part. That's the transitions, the workload, like, but it's not worth stressing out. I'm like, I remember my first like semester, it was stressful, like, to be honest, because just so much material, so many exams, like, like, it was never ending, like. But then, what I told myself is the exams are never gonna end. Like, there's gonna be there. It's endless. Like, so it's not worth like stressing over a semester, or like, you know. So yeah, bottom line is like, don't worry. You shouldn't worry about it, because in the end, especially you students, you guys are students at Columbia. You're smart. Trust me. I know. Like, I know that for a fact. You guys will 100% be able to transition. If you do your if you just do what a dental student's supposed to do, like, you'll be okay. Like, yeah. So
And you kind of maybe hinted at it, but what's the day to day like? How does a dental student, either D1 or D2, like you are now, or I know you haven't done it yet, but even in the D3 and D4,
yeah,
how
yeah.
does that kind of day to day go?
I know, I roughly know, even, yeah, what, you do in your third year, fourth years, even though, so I can even, comment on that. But here, like, it varies, like, from school to school, like, but somewhat, like, now here at Columbia, like, year, our first year and semester is basically is basically with the medical school. So we learn so many overlapping courses. Like, so the first year is like, you learn the body systems, like, which is in medicine, like, cardiology, pulmonology, neurology. We learn, so there's a lot of basic science learning the first year and the first semester, like, less, really dental related courses, though we still have those courses, it's not like the curriculums for the dental student and medical student are identical. They're like 80% similar, whereas they fine tune theirs. And I'm telling this is for the year, first year and semester, just so I can be exact. Like they're 80% similar, except us, for example, in our first, I'll tell you, for example, our first semester, we took biochemistry, we took pharmacology, and we took genetics. These are the three key basic sciences that medical students learn as well. But we also took a dental anatomy course, that taught us dental anatomy. And we also, towards the end of the semester, we got introduced to preclinic, and we even started drilling for the first time, like working on our hand skills. Second semester, we took basic science courses like neurology, um, pulmonology, renal. These are all the basic sciences, but we also took some dental courses that the medical students didn't take. Now, like in our fourth semester, so that's after the year and first semester, it's all dental courses. So, for example, now as a D2 in my second semester, the course that we started off with orthodontics, a 2-week course on orthodontics, and now which is braces, like basically. I'm sure you got, in case you guys didn't know, like, and then now we took a course on peds, so children dentistry, like, and yeah, it's all dental courses at this point, and but it's still preclinic, as we're not seeing patients. But in your third semester, or sorry, third year, so after this semester for me, we're gonna start actually treating patients. We're gonna start, it's basically clinic work as a third year and fourth year student. And what I've heard from like upperclassmen is it's basically like a job. You go in, you treat your patients, and you leave, like, which is cool. Like, I mean, it's thus like you go in, you do your job, and you're done. It's as opposed to like when you're a second year student or first year, you're always studying. You have that quiz like on Wednesday and that like exam on Monday that you don't want to study for. Like, so it's like it becomes nicer. That's what students told me. But yeah, that's basically what each year is like, like roughly, at least for us here. But I'll be back. I'm just gonna get some water. Yeah. All right.
I have a question.
Yeah.
How is it like?
Yeah.
Do you like being with the medical students? Do you find it to be like confusing or like more challenging because you're with them, or is it like nice to be with them?
It's honestly, it's fine. I didn't, like, as in the courses themselves, like I like the medical courses themselves, I liked, and being with them, like, was is fine, honestly, because you're just in courses with them, like we also, like, for example, we had anatomy, like, and so we had anatomy lab, like, so dissection, and we worked with them, like, also it was nice. It was, yeah, it was not, not bad, like, at all, like, yeah.
Is the organization like of the classes more focused on like med students, or like you feel like that like dental like it's very organized for dental students also?
It's more like, it's more medical, like it's basically like didactic work is, it's it's really like your medical school curriculum, like you learn the body systems, like, so some people can feel like, it's basically like medical school, like 80%. Now, like, that can be a good thing, like, because um which you guys will learn later, like, for example, if you want to specialize, like, and one specialty is oral surgery, like, if you want to do oral surgery, you have to take an exam called the CBSE, which is basically like step one, which is what medical students have to take. And so having this medical curriculum is like key for that, because like step one's like a huge ass like exam, you know, like mine, I'm sorry for my language, like it's a huge exam that requires so much studying. Like if you're a dental student at a school that doesn't teach you, you have to do so much work alone. So like for example with Colombia, like it helps you a lot, you know, by having this medical school curriculum. So for students, like for example, who want to do oral surgery, like knowing they want to do it before choosing uh, which dental school they want to go to, this medical curriculum is really advantageous. Like I can tell you for me, for example, I want to do personally, like I want to do oral surgery, and I like I thank God for this curriculum, like the medical school curriculum. Like it provided me with a good foundation that, you know, now when I'm studying for the CBSE, like I'll be in good shape to take it, you know. And FYI, like one thing, since I told you guys about the CBSE, like and you know oral surgery. When you apply to oral surgery, like your CBSE scores like everything. That's something you'll learn like later. So that's it. So that's gives you an idea of how critical the curriculum can be. You know what I'm saying? Like yeah.
And as far as I know, you had kind of spoken a little bit about being in classes with the med students as well. What's the community like, either with them or just within the dental school?
Honestly, um like the first semester and a half, like you're gonna be with them in class, like but like most of your friends will, like at least for me, like I can tell for most of from my friends and my friends friends, like are tend to be dental, because you do everything together, you know, like even though you do 80% of things similar, like with med school students, like it's nice to befriend them and work with them, like because again they're like a different health professional, so it's like they're a different like type of healthcare provider, like they'll be, so there's a lot you can learn from them, like by interacting with them. So it's a nice thing, like it's what they call like interprofessional, like collaboration, like so but yeah, it's nice, like yeah. But most of the time you'll be with your, especially as go into your third year, you'll be in clinics, so it's all you're doing is dental work, and I know you're gonna be with your peers, and you guys will also have like requirements for, like for example, cases that you need to do, and sometimes you can trade patients so that you can fulfill your clinical requirements, so someone, for example, who has a patient who needs a root canal, and he already fulfilled his endodontic requirements, can give you his patient. So that just gives you an idea that most of your collaboration will be with your dental school students, so yeah.
And as far as from, professors, faculty, all of that kinds of stuff, administrators, um, is there like a good support network? Uh, or do they kind of, toss you out and say, figure it out a bit more on your own?
No, no, definitely, like I mean, I'm speaking on behalf of, like, the first 2 years. It's definitely, like, I'll tell you, for me, you know, like my brother is a dental student as well, but at the University of Michigan. And by talking to him, my God, like it seems like they have it so much worse, as in they have so much more things to figure out. And really, I'll tell you, um, the 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 faculty is so lenient on you here. It's great. I'll tell you, for example, like tests. For example, exams. Like our curriculum is pass fail. FYI, like I don't know if you guys don't know that, or I mentioned it, but if you fail an exam, for example, you just have to take it again and remediate and pass it, the consequences aren't so bad. It's so much less stressful. Whereas, I don't know, don't quote me on this, but I know like in other dental schools, like you can repeat the year if you fail an exam. That's what I heard. Like I know my brother was telling me, for he took an exam like his first semester, like in University of Michigan, like it was some like genetics exam, I don't know what, and if you failed it, you had to repeat the semester. Like that's scary. you know, we don't have anything like that, thank God. Like so it's very lenient here. So yeah, so lenient. Like the faculty are so nice, like, and they really like do their best to like make it as less stressful as possible. You know. So yeah, like I'll tell you, for example, with me, like I'll tell you the story. Like um, in the past semester, um, towards the end of the semester, like I had two finals, and unfortunately, the days before, I contracted COVID. Like just out of nowhere, it hit me, and I got really tired. I literally could not get out of bed. Like could not study. So and my exam was in 2 days. So I emailed the dean, like Dr. Wolf, explained to her my situation, and they were able to accommodate me and give me a few more days to rest and then take the exam when I'm all healed, recovered, able to study. So that's something I really appreciate. It's things like that makes it so lenient for you. Like and convenient. Yeah. So yeah.
I have a question.
Yes. Yeah. Totally.
Before you said you wanted to be an oral surgeon, so I was just wondering like why you chose that.
Now, like, now why? Like, I took like a gap year and a half like before dental school, and I wanted to explore all the specialties, like, and um, with oral surgery, the scope was just amazing, like to me. So I shadowed some like oral surgeons, and most oral surgeons that you shadow, they're in private practice. They're doing oral surgery, not the maxillofacial like aspect of the field, and that's cool to me. Like I honestly really liked it, but then I wanted to investigate more and investigate more into the field and the other aspects of it. The other like the maxillofacial component is also pretty crazy, which you can also do as an oral surgeon. So for me, to put it simply, why I want, like, why I decided, what, like, of course, dental school, but I definitely want to do oral surgery is because the scope was just amazing. Like, it's just crazy. So yeah, it's not like now it's people don't want to encourage you to entertain a specialty before dental school. You know, it's just that's the way it is. They want you to know you want to be a dentist first, and then, for example, an endodontist and oral surgeon. But for me, in my opinion, to be honest, if someone wants to entertain that they want to be an oral surgeon, I'm not gonna give them hell. Like for it's not a bad thing. So if you guys entertain it now, why not? You invest, like, see if you like it. Like people tend to say, for example, like when I came in um down school, and they were like, what do you want to do? Like I was like, oh, oral surgery. Like, want to do oral surgery? What do you know? Like people will will what's it called? They'll, I don't know how to put it in a less like in a less offensive way, but they'll criticize you for being naive. Like, but if you know you want to do it and you looked in and you did some research, go ahead. Do it. Like, so that's my opinion, and that's why. And I know that's your question was why oral surgery, but that so I explained why oral surgery, the scope. Like, yeah.
And as far as uh, doing oral surgery, that's about as I know you said earlier that you liked how it's you have to be hands-on with
Yeah,
dentistry. That's about as hands-on as it gets.
exactly. Yeah, yeah. Because now, it's not just, like it's not just oral surgery, but maxillofacial surgery. So, so many procedures you could do, like, which I got to learn more now as, a second year dental student, because you do take courses on, I mean, just really learning anatomy and head and neck anatomy, and learning all they teach you courses, you learn more of oral surgery, and the things you could do is just, yeah, crazy. It's there's a lot of overlap, for example, with uh, a decent amount with plastic surgery and ENT, for example, like, so yeah, it's definitely, so much hands-on, like.
And as far as I know earlier you had talked about how, you might have a quiz on Wednesday, an exam on Monday. There's a lot of information getting thrown at you, tons of stuff happening. Sorry, there's a clock next to me. Um, how do you how do you balance everything? How do you keep everything going? Whether it's studies and social life or extracurricular, maybe doing an externship or shadowing a specialty, something like that. How are you able to balance it all and make it all work?
It's a good question. Yeah, like, yeah, basically what it is that you need to be organized. That's the simple answer. You're gonna have to be on your schedule, on top of things. You can't, just, if you don't have a schedule, at least for me, you're gonna get screwed. Like, because everything's gonna start piling up. Like, so being organized is really critical to solving that. Because, again, you want to have your social life, fine. You want to, do stuff with your friends, but if you're not, getting your quizzes done, you're not on top of your readings, you're not on top of your lectures, it'll all start to pile up, and then you're gonna just have to cram. And I'll tell you, like, the amount of material that you learn here, yeah, you cannot cram. At least I cannot. Some people can. Hats off to them. Like, God bless them. Like, they're wonderful. But me, I cannot. Like, So there's just so much. The load is just so much that you need to be organized if you still want to have your social life. If you still want to play your sport, for example, me, like, I box, like, I love boxing, like, and I want to go 5 times a week, no matter what. So I make sure that I factor it into my schedule. So I'd go at 7 p.m. And before that, I'll make sure that I just have to get whatever I have to get done before 7. If I wake up at, you know, 7, if I wake up, whether I wake up at 7 a.m. or 1 p.m., I'm very flexible. So having had that structure in your schedule is key. Like, that's really what's gonna help you, like, thrive with all the demands that are gonna be placed on you, in dental school. Being organized, and, yeah, just so you don't have to sacrifice one thing. Because if you come in and say, and you come in and you have a significant other, if you do not factor that time that you need to spend with them, one party or the other is going to suffer, whether it's dental school, where you're not really putting in the commitment to stay on top of your work, or your partner, for example. So it's all just your priorities, and sticking and staying as organized as possible. Yeah.
So, as far as looking at the different kinds of things that you do in dental school, you talked about having clinical stuff, didactic classes, learning different units about, maybe specialties like you mentioned, orthodontics, for example. What's your favorite part so far of dental school? Or if you haven't chosen something that might be your favorite now, what's something you're looking forward to in D3 and D4?
Honestly, me, like, as you already know, like, oral surgery, like, I really love the field. It's so cool. Like, like I always like to tell people like dentistry is cool, dentistry is nice, but oral surgery is epic cool. Like so, that I can't wait to like get to clinics and start doing the oral surgery procedures, extractions, like and whatnot, but also like even like shadowing in the OR. So that's something I personally I'm really looking forward to, you know. And but a lot of dental students I know like they're looking forward to clinics in general because you're gonna start treating whether you're doing restorations, treating caries, cavities, like or you're gonna or taking X-rays, diagnosing, like diagnosing class three uh, carries. That's really getting in the field and actually engaging. That's what I'm sure like most students and most of you will be looking forward to, especially like with your first 2 years being just studying and exams and studying and exams, like very monotonous, like so. But yeah, for me, it's yeah, you know, getting into clinic oral surgery, like yeah.
Do they give you lots of opportunities to get into ORs, for example?
Yeah, I mean, like for me, for example, like I emailed one of the residents like the other day actually, like, and he responded right away. He's like, hey man, like gave me his number. He's like, just message me on Friday. I'll tell you what cases we have going on. So yeah, the residents are so nice, like they just respond to me casually, like right away. So I mean, here, yeah, like for example in the OR, like yeah, residents are nice. They let you shadow and stuff. Yeah.
That's awesome. And because we just went over your favorite part of dental school, now I'd like to ask you about what your least favorite thing might be, or something that you find maybe particularly challenging about dental school.
Let me. I'm gonna think. Like, I don't want to. What's it called? I don't want to say something to discourage you guys. Like something that I like that I don't like that you guys just love. Like so. I'm thinking. Um, I mean, for me, really, there's no part I dislike. Like that's annoying. I mean, no, like even me knowing I want to do oral surgery, like you're not gonna, as an oral surgeon, you're not gonna do restorations. You're not gonna do them at all. You know what I mean? Done. Like you're just gonna do extractions. But still, so with that said, you can imagine that because I know for sure I want to do it. Like doing the just practicing restorations now kind of feels like useless long term. But at the same time, I shouldn't dislike it. I don't dislike it and I shouldn't because at the end of the day, I need to fulfill my requirements to be a dentist. You need to know. So again, it's not something I dislike, but it's something that, knowing what I want to do, I knowing what I want to do, like I don't feel as engaged with it, but I still need to not I still need to excel in it and and do it right. Just so I could be a dentist before, I need to be able to walk the walk before talk the talk. Make sure I can actually be a dentist before I can, you know, yeah, be an oral surgeon. Like for example, one funny, like I remember we were having a lecture by an oral surgeon, like, and he was telling us this something like pretty interesting. He was telling us um, that for example, nose fractures oral surgeons are better at treating than ENT doctors, and the reason is why is because your maxilla is has your teeth, and that's connects with your mandible, and that's your occlusion. And oral surgeons know teeth. We know teeth like because we're dentists before that. We know the proper occlusion that's supposed to happen. Whether it's a class one occlusion, we know how teeth are supposed to come together. So knowing that, that's how you're able to perfectly get the bones together and fix them. Like, and I thought that was like really cool. Like, it just goes to show that you need to know your teeth before before anything. So it's a reminder that not to get ahead of yourself, like, and yeah.
And this is kind of, I mean, maybe more specific to these times. I mean, obviously, we're doing this fireside chat over Zoom. So, as far as COVID goes, and I know you said just before that you had it before your exams. How is that, besides impacting your exam schedule? How has that affected the way that you guys are learning, the way that maybe you're being exposed to dental school?
Honestly, thank God that COVID happened now while I was a first year student. Why? Like, sorry to the third and fourth year students, but everything we're doing now is just literally exams, like, and what's it called, and lectures. So to me personally, it like, I don't mind Zoom. I personally like love watching lectures at home. By the way, Columbia gives you the option to actually go to class or to just watch lectures. And if you want to go in class, you have to wake up early at 8. And me, let me tell you, like, I don't like waking up in the morning. So even before COVID, like, I rarely went to class. So when COVID happened, to be completely honest, it's as if nothing changed. Like, because I was just still, I was like waking up later because I like to stay up, like, and watching the lectures at my own time, and still doing it, at home, and so how it impacted it as a first, second year, not really, to be honest. It just maybe took away time from some pre-clinic, but we didn't do a lot of pre-clinic, like, but I heard for, the third and fourth years, all you're doing is clinic, and so when COVID first happened, and there were all these restrictions, they definitely, didn't have as much, they sacrificed their clinic times, unfortunately, like, but to me, yeah, I mean, like, thank God it happened now, if not like later, like, yeah.
It's that's a good way of looking at it in positive light.
Exactly, yeah, being optim, like, just trying to, like, it happened, like, you can't do any, it it's a fact, it happened, it's real. But you have to look at it optimistically, like, yeah. I know, for example, like, also, some students, like, it was so advantageous for them because, like, when I was a D1, and my friends who were D2, like, they were studying for the CBSE, which you'd usually take as a D2, which is the oral surgery exam. And to them, it was a blessing in disguise. Why? Because that took away so much of their clinic time and gave them so much more time to study for it. So, like, that's just an insight into how things like this can affect you as a dental student, depending on your goals. So, yeah.
And when we were emailing each other, you had said that you were excited to kind of maybe give us advice, which you have been, and we're
Yeah,
appreciative of
yeah,
that.
yeah.
So, now is a great time if you have,
Yeah,
anything that we haven't asked you.
exactly. General advice, like the main core ones, like, um, if you guys now, like, what year are you, for example, David? Like,
I'm a senior.
oh, senior. Oh, nice. Like, so you, like, with, if I remember, like, are you gonna take a gap year, or are you gonna apply? Like,
Yeah, I'm doing research for a little bit.
oh, nice. Yeah, yeah. But I can give you more specific advice, but in general advice, like, before I do that, like, first 2 years, your first year, your second year, I'm not going to discourage anyone. If you want, start shadowing, like, your first year of college. Why not? Like, you don't have to, but why not? Like, get, really learn more of the field. I didn't do it, but if I knew at that time that I really wanted to do dentistry, I would have done it. You don't have to do so much, just so later you don't have to do crazy hours just to accumulate them. But make sure you do well on your courses. Like, your GPA matters. It matters a lot. So do as well as you can on all your college courses. Try to keep your GPA as high as possible. That's really the raw truth right there. And then right with that is your DAT score. So try to do as well as you can on it, you know? No pressure, like just study for it for a good amount of time. You know, I, for example, studied for it for 3 months, about 3 months, and that was enough to do as well as I wanted to, you know? And do as well as you can on it and do well on your courses and then get your shadowing hours and then everything else is going to be supplementary, you know? And but it still helps, like it would still help once you have all those bases covered. Something like research can really make you stand out, for example, what you're doing, because you don't want to just be the like the when you have all these good applicants, you know, the guys with the good DAT scores and the good GPAs, you pass the screening, you know, for dental school. But then they want to see what makes you different, you know. So that's where, you know, you want to, after you covered all these bases, you add in the supplementary stuff that's gonna make you, you know, that's gonna differentiate you from everyone else. Like, so yeah, stay on, do as well on your courses, you know, study hard, and then do as well as you can on the DAT. That's the most important thing, you know, the general advice. Like, oh yeah, and one other thing that's I remember right now, apply the first day. The first day the application opens, submit your application. And what I mean by that is work on, fill out the whole application way before, because there's a template you have online. Fill out everything, your supplementary questions, have your personal statement done way before. That's what I did. Like, have everything completed so that when it opens, um, what's it called? You submit it. Why? Because it's rolling admissions. You can be the perfect candidate, you know? You can have the 28 on your DAT, a 4 point average, and you helped, you did some research that cured, you know, some cancer. Like, but if you apply like March, I'm sorry, all the spots are filled, you know? And just to give you some insight. So that's the thing. Timing is huge. And I just remember that now because I remember when I was applying, that I stressed a lot. I remember I finished everything. I finished my whole application way before. And I remember the day it opened, I just submitted it, you know? So that also timing, I would write that down. Like literally, all of you guys have to submit your application the day it opens. Like, if you don't, I'll be disappointed in you because you guys now, like, you know it from me, you know what I mean? Like, yeah, applying early. Yeah.
I just wrote it down.
Yeah, yeah, yeah. First, you know? Because imagine it's like rolling, like imagine if you know it's rolling. I don't get how people would like not like just not have it done. It's like, dude, just finish it before. It's such a huge factor. Like, why not? You know, it's like it's within your low self control to finish everything. It's not like it's not in your hands. So yeah, applying early. Yeah.
And then, one last thing for me,
Yeah.
until, unless anybody else has other questions, is if you could go back in time and give yourself one piece of wisdom or advice,
Yeah.
maybe, earlier on in your studies, either when when you discovered that you wanted to go to dental school or even before, what would you tell
It's a good
yourself?
question. Yeah. Honestly, nothing. I did everything perfectly. No, I'm just kidding. uh, what do I think? Like, um, for me, I was a person who just I'm a person who stresses a lot, make sure everything's great. So one thing I tell myself is don't worry too much. Don't I wouldn't like I wouldn't have put as much work as I had done. But again, is that really like it's not really like I mean that like I'm not gonna take away what I did because I'm happy where I am now. But don't stress. You know, don't don't stress your time as a college. Don't over stress your time as a college student because it's only gonna get harder. You know, like that's one thing when I look back, don't really don't really dwell on, like failures. For example, you did bad on a test in college, don't dwell on it. There are so many more. They're never gonna end. Like, so yeah, that's what I'll tell myself.
Does anybody else have any questions they want to jump in and ask?
If you guys don't remember your questions now, like don't hesitate to reach out to me, ask me questions. Like, so yeah, if you don't remember it now, like it's crazy. I remember like in Michigan State, like it was like a few. I remember when I was like a pre-dental, it felt like yesterday. Like I remember looking at like even I was looking at what's it called, that like when I was a sophomore, and I was looking at the seniors in college who actually got into dental school, and I was like, whoa, who are those, like those guys, like they're astronauts. Like how can they do it? Like, trust me, you guys will get there. Like, it's intimidating, but it shouldn't, get to your head. Like, but yeah, did you have a question? Like,
I have a question.
yeah.
You mentioned that you took a gap year, and I know you said you did some shadowing. Is that what you did during your gap year, or did you do other things also?
Yeah. I what's it called? I I actually worked as a dental assistant in my gap year, and I also did some research. Like, funny enough, yeah, just like David. And also, since you bring up gap year, I'll tell you, my gap year was one of the best decisions I ever made. Why? It's just, it's a first of all, it's a break, and I was just able to make my application better. I did some more research, like did some poster presentations here and there, like was able to make sure to do those. Worked as a dental assistant, and like at even like worked with other dentists. So like when I was filling out the access, I listed, it was more than one experience, like, so it wasn't just one dentist that I worked with. So that helped, like, so yeah. Since you brought gap, like even I'd advise like a gap year, but that's not if anyone wants to, you know, go straight to dental school, go ahead. Like, not, that's not to say, if you're not ready. Like, but yeah.
Great. Well, unless anybody has anything else. All right. So, Dani, thank you so much for speaking with us. This was really great. And, I'm speaking for all of us when I say, we really appreciate all of your advice and for coming to speak to us at all. And to, tell us about CDM and all of your experiences. So we really appreciate it. And this was really awesome. Thank you so
Yeah,
much.
of course. Like, this is so, like, even for me, like, so refreshing. Like, because it wasn't too long that I was in your shoes, like, so it's, yeah, I'd love to give back, give you guys some wisdom, that you guys need, like, as you, apply, like, get ready to apply to dental schools. And also, don't hesitate to reach out to me. If David, if you want, like, if you can tell them my email, like, if they want to, let me know of any questions or anything. So yeah.
Definitely. I'll circulate that.
Right. But have a good night, like, guys.
Yeah. Thank you so much.
Nice talking to you all. See ya. Bye.
Thank you.
Bye. Take care.